So we are talking today about need for accuracy in homeopathy. This is the main talk for today's webinar that we are talking about. And what do I want to talk to you about? Basically, is the need for exactness. I think this is one of the most important things in homeopathy. And when I go through a lot of my cases and I try to analyze where I kind of went wrong, I think most of the time the cases which have not done well are cases where I have tried to fit a remedy in a case, or where I have tried to fit a remedy into a particular remedy picture or a drug picture that I know. So this is the kind of image that I'm trying to break in my mind, where the kind of thing that we have learned about drug pictures, the pulsatilla is very emotional, phosphorus is very extroverted, lycopodium is a boaster, or Naxomica irritable. And this kind of drug picture in our mind, which is a good idea to learn, the remedies can be often a block while treating patient, because you might perceive a patient as pulsatilla and actually not go any further than that. So this is what I am going to share with you today. The idea that we try to kind of fix a patient into a set of remedy, and we never tend to get the patient out of that remedy. So what to do? And what I tried doing is try to focus at the bit that doesn't fit. That is the bit that doesn't fit like pulsatilla. The bit that doesn't fit like the picture that you know about the remedy. So I'll give you an example of a case. This is a case of a 40-year-old lady, and she's a allopathic physician, a pediatrician in Hyderabad, and she's having convulsions for last so many years. She's also a known case of diabetes, hypertension, insomnia, and she's taking anti-epileptic medicine. And she gives very peculiar convulsion symptoms where she says that when she gets fits, post fits, she gets very loud burps. And she feels very weak post convulsion. She feels very sleepy, and entire body has cold sweat, and she gets confused after this kind of fit situation for about a couple of hours. She describes her state of mind as being very friendly, extroverted. She is very sensitive. She likes to be alone but also anxious at times. She is very scared of being alone, of darkness, of illness, very worried about future. She gets into quarrels with her husband at smallest things, and she gets very emotional at times. She is aggravated by cold, and she has disappointments. So you see this anxiety, you see this extroversion, you see this quarrelsomeness, and you want to think about a remedy like Kalika or phosphorus or pulsatilla, because this is the picture that the patient is giving. So where did we miss the plot? Is what I try to do is we can go over different levels, but often what we actually kind of don't focus at as the things that we didn't understand in the field. For example, this kind of eructation, perspiration, cold, and weakness post convulsion is something that we don't know, and that would be the very strongest feature to focus in the case. So what I would do, instead of thinking about the mind symptom of fear, anxiety alone, which is kind of common, even I feel anxious if I'm alone in darkness in a forest. So it's a common symptom. You want to focus at this phenomena of the disease. And when you focus at this, interestingly, you take eructation, convulsion after, and weakness after convulsion, you get only one remedy, that is China horse. And if you read Herring, it's written eructation epilepsy. And when you read Herring guiding symptom, you see a very, very interesting symptom which I want to show you. You see that epilepsy, and this is from the provings of Herring guiding symptom from nervous system, epilepsy after attack, cold perspiration, eructation, and feeling of utter prostration that patient believes he cannot endure it for long. And we gave China Arts 1M. And this is why I want to tell you the follow-up within 2 weeks, that the fits reduced by 50%, which she was getting almost every day. And then after 3 months, I even started reducing the anti-epileptic levels. She did very well. This I wanted to tell you was one of the very important path-breaking cases for me. And then from then on, I have tried to focus at the disease and what are the characteristics in the disease. Like One of the cases of conjunctivitis would tell me whenever there's a weather change, the patient would get conjunctivitis. Dalkamara is a good remedy for that. But the characteristic in the conjunctivitis, because the patient sent me a picture, was this conjunctivitis was more on the right side and the outer part, the redness condition. So now if you open the repertory, eye redness, canthi outer right, you see only one remedy there, carbonium salt, which helped the patient. Obviously, there were more symptoms of carbonium salt, which I then kind of went through and matched. Similarly, this is another case of asthma, and the patient would tell me that she would get very anxious, and especially the asthma would be more when she would lie down and would feel better after drinking warm with a lot of thirst. This gives you an idea of arsenic, isn't it? Now, if you open the repertory and see respiration asthmatic difficult, drinking warm ameliorate, you will see only one remedy, that's spongia. I remember this case, the patient would tell me I get a lot of vomiting, but constantly in my nose I feel as if some mutton or some meat smell is coming. Meat like rotten illusionary smell, Paris quadrifolia. This fantastically opened me the case. One patient would tell me I would get chills only after 3 p.m. Did very well on Puja. So what I want to tell you is you need to search in a given case what you don't know. And this is what I want to tell you, and this is what I tell myself, and that's why I can tell you get out of your comfort zone, dear homeopath. Get away from well known drug pictures only. If it's indicated, go ahead. But don't fix. Get away from themes. Themes that, oh, is very 4 seconds, so magnesium. Get away from what you know. Focus at the unknown. Explore the area that you don't know. Explore the peculiarities. Explore the most prominent unfocused areas in the field. And I'm in this journey to really understand this kind of phenomenon. And I'm happy to share with you more. This is my email ID, gaurang@gmail.com. And you can write to me about this webinar and how did it go, and maybe I can share more. Thank you.